Hello and welcome to the Real Life Cafe. My name is Juliet. Thank you so much for choosing the Real Life Cafe. Thank you for your continued support. Thank you for subscribing. Today we are going to discuss about vaccines for newborns. We are going to learn the importance and why every other mom should ensure that the baby is vaccinated. I am joined by Dr. Ruth Kihara, a pediatrician here at Emory Hospital, who will help us understand these more. How are you?
I'm fine, thank
Ukoaje?
you. Kwa salama kabisa.
Good to see you again.
Thank you.
Asante sana for making time to come to the Real Life Cafe, and asante sana even for your continued support. We appreciate.
Thank you.
Kindly introduce yourself to the people there and tell us what you do.
All right. I'm Dr. Ruth Kihara, a pediatrician. I'm also a lecturer at Mount Kenya University, Department of Pediatrics, and I run clinics at Emory on Wednesday afternoons. Yes.
Wow. Today we are going to discuss about vaccines.
Yes.
You know, and learn why it's important to have babies vaccinated. But first, maybe you can tell us what vaccines are.
All right. So vaccines are components given to anybody, to either children or adults, and they come in various forms. They can be live, they can be passive vaccines, they can be particles, and they are given for purposes of stimulating the immunity. And when you stimulate the immunity, you create what we call memory cells. And so therefore, the next time your immunity is faced with a similar organism in form of an infection, it will remember to mount an immune response that will now fight the infection. So that's how I can describe vaccines in the simplest form way, the simplest way.
Okay.
Yes.
Why is it important for every person to be vaccinated?
Vaccines are important because, as I said, it stimulates the immune system, and so therefore it creates a hedge, if I can call it like that, of protection around the body. And it's more important for the babies because, one, their immune system is immature, and as such, they are vulnerable to diseases. Under the age of 5, children are vulnerable to diseases because their immune system is not as mature as it ideally should be. Yes.
Okay.
So vaccines come in to, to stimulate the immune system. Yes.
Can one use the word protect? Do they protect you from acquiring those diseases?
Yes, some protect, some reduce the severity of the disease in case you get to the infection. They actually reduce the severity.
Okay.
Yes.
Explain to us the vaccines that a newborn gets immediately after birth.
Okay. At birth, before the baby leaves the hospital, ideally they should get hepatitis B vaccine. They should also get the oral polio vaccine, and they should also get the BCG vaccine. Oral polio is given orally, just as the name suggests. BCG is given on the lateral aspect of the forearm, the left forearm, and then hepatitis B is given on the thigh. Yes.
Okay.
As an injection.
Okay. BCG inakuanga ya nini?
BCG ni ya kutuzuia kupata what we call TB, a form of TB called miliary TB. Yes. So hiyo inazuia TB because vile tunaishi in I can say we are in a developing country, and so therefore we have instances of crowding, instances of where our reach to hospital is not that good, access, and all that. So there's lots of TB around, and we need to protect our babies from getting TB. So BCG does that for us.
Okay.
Yeah.
So Daktari, kindly take us through the calendar, the schedule that the baby should go through so that they acquire all the vaccines.
All right. So interestingly enough, I would want to start by saying that vaccines are not just for until 9 months, because most mummies believe vaccines are given from birth till 9 months. After that, tumemaliza vaccination. Vaccines run up to the age of actually 10 years, and we also have other catch-up vaccines. And recently, we also have the vaccines for adolescents. Yes, for cervical cancer. And so vaccines basically run through your whole cycle. So maybe I can display this calendar here.
Okay.
It's a calendar that has been given to us by Sanofi, and it's quite comprehensive in describing what the baby should have.
Okay.
At birth, as I said, should have hepatitis B, OPV, and BCG for TB. Then at 6 weeks, we have the Hexazim. Hexazim is basically a combination of 6 vaccines in one. If you look at it, it's you can see DTaP, IPV. DTaP is basically, D is for diphtheria, T for tetanus, yeah, and then injectable polio, then Haemophilus influenza, and hepatitis B. So it's a combination of 6 in one. You should also give the baby oral polio and PCV. This is a pneumococcal vaccine, and it's given at 6 weeks, and then rotavirus vaccine. This is given orally. So we have a repeat of this at 6. We give it at 6, 10, and 14 weeks. So until baby is 14 weeks, they get similar vaccines for the 3 visits.
Okay.
Yeah.
And those 3 vaccines
Yes.
like they protect so many
illnesses. Yes.
Okay.
Yes.
Okay.
Yes. As I said, the 6 in one, it protects the baby against 6 conditions, and then now we have the PCV and the rota.
Okay.
So ideally, the baby should have 2 injections. Yeah. If that is, if they are getting the baby-friendly ones, which we have the 6 in one, 2 injections and 2 oral vaccines. Yeah.
Okay. All right. So after 14 weeks, maybe you can continue
Yes.
with it.
After 14 weeks, most mummies also forget to take their babies for the monthly weighing. They should do that. But at 6 months, there's a vaccine which we call the flu vaccine, given at 6 and at 7 months, repeated at 7 months again. Then at 9 months, for areas which are endemic for yellow fever, we should give yellow fever vaccine. But this is not endemic in Nairobi, so most mummies don't get, their babies don't get yellow fever. They will instead get MMR. Then at 10 months is a very important vaccine called meningococcal vaccine. So basically prevents the baby from getting meningitis. I normally at times say, if you miss everything, please don't miss this, because meningitis is very fatal. And at times the signs are missed. So this is a very important vaccine. Then we also have at 1 year, 1 year we have oral cholera vaccine, which is given in 2 doses, 2 weeks apart. And this oral cholera, I think I should mention, it is oral, please, not injectable. And then hepatitis A, and then chickenpox. So this is given at 1 year. Together with this, we also give vitamin A, and we also deworm the baby. Deworming is also done at, vitamin A is also given at 6 months. So deworming we start at 1 year, then every 6 months they visit for their vitamin A, we also give deworming, dewormers. I should mention about MMR, this vaccine that is given at 9 months, measles. Now, I need to mention that babies whose mummies are HIV positive, they receive this vaccine earlier on at 6 months, and it's repeated at 9 months and again at 18 months. So these are special babies, and why we do that is because their immunity tends to wane off earlier, because we have mummies, children getting immunity from their mothers, antibodies crossing from mommy to baby. But mummies who are HIV positive, the transfer of antibodies, as much as it happens, it wanes off earlier. And so they get their MMR early, the measles early, at 6 months, 9 months, and 18 months. Thereafter, they should get their yearly flu vaccines. At 2 years, we give the typhoid and the flu vaccine. 5 years, we give boosters of what we gave at 6, 10, and 14. Yeah, we repeat that. And then now the annual flus, and I think maybe we'll discuss later about the special vaccines that we give to special populations. Yeah.
Okay, and the schedule that you have given us, is it, are those vaccines under KEPI, or maybe you can help us understand the vaccines under KEPI and others which are also important?
Okay, so the KEPI schedule, this is the schedule that is provided for us by the government, the Division of Immunization, and vaccines are expensive. Maybe I should start by saying that. They are expensive, and the government would most times subsidize vaccines to make it universally affordable to everyone. Yeah, and so they give the most, what's considered to be the most important, but there are other vaccines that if mommy is able to afford, should give to the baby. Yeah, so the KEPI schedule runs this similarly, only that it doesn't have now the 6-month vaccine and the 7-month vaccine, and the other additional vaccines for 10 months, the meningococcal, the 1-year vaccines, is not considered to be in the schedule of KEPI. But even the KEPI vaccines, those are the basic essentials. So mommy should not feel like I'm not able to afford the extra vaccines, and is my baby at risk, or am I exposing my child? It's through research considered to be enough for the baby. But if you're able to afford, please let's give the extra vaccines. Yeah.
Okay, so which ones are those that one should not miss?
That is the birth vaccines, the 6, 10, 14 week vaccine, 9 months vaccine. At 1 year we do deworming, deworming and vitamin A. Yeah, and then now the other, let's say for the adolescent group, now the HPV vaccine. Yeah.
Okay.
Yes.
And you had mentioned to me about vaccines for special groups. Maybe you can elaborate more about.
Yeah. Now, in the pediatric population, there are groups we consider to be special. I think I've talked about the babies who are HIV exposed. So these are babies who are exposed but not positive. Yeah, you're just exposed in the uterus, but not HIV. The status is not HIV positive. Okay? So these babies require their measles earlier than the general population. So they'll get it at 6 months instead of 9 months.
Okay, 6
because
months.
of the explanation I gave.
Yeah.
Then there's another group of children still in the same breath of HIV, because we know HIV reduces our immunity. And as such, there are vaccines we don't give to children whose immunity is compromised. Yeah. And the live vaccines, those are the ones we avoid for children who have, let's say, full-blown HIV, and the immunity is not as good. So there are live vaccines, we avoid those. Now, there are vaccines that we give to children who have sickle cell. Yeah. And why we give these special vaccines to them is because with time, what sickle cell does, there is slow death of the spleen. Yeah. What we call autosplenectomy. Because of the repeated, events, necrotic events in the spleen. So eventually the spleen sort of dies off. And the spleen is a store of our immune system, if I can call it like that. And as such, the children are exposed to conditions that are caused by bacteria that have that special bacteria. So these vaccines that we should give to them include the conjugate vaccines, And so we'll give them the pneumococcal vaccine. We also give them the typhoid vaccine. Yeah, so that they are protected against these bacteria that affect children whose immunity is compromised as a result of lacking a spleen.
Yeah.
Yeah.
Okay. And are there side effects that come with the with some of the vaccines? Because I remember with my two girls, I don't know whether it's the 6 or the 10, you know, there's so much fever, and I hear some other moms say like the baby get rashes. Do we have some
Side effects
that come along with the vaccines?
Yes. Remember I said some of the vaccines are live, and that means I'm giving you a part of the bacteria. Okay. A component of the bacteria.
Yeah.
And as such, when it's introduced into your body, it stimulates an immune response.
Yeah.
And part of this immune response will be manifested with fever. And so part of the, I can't call it really a side effect, part of the reactions that we expect to happen with vaccines is fever.
Okay.
Yeah. And so, of course, mommy will panic, and, you know, what we advise is just, you know, reduce the clothing, wipe the baby with some warm water. If not going down, then now you can give paracetamol, but it shouldn't be given, it should not be given before 8 hours have elapsed after the vaccine.
So it should be 8 hours after the vaccine.
Yes.
And it's after you've realized the fever is not going down.
With exposing the baby and wiping with warm water. Yes.
I just remembered something. You know, in this journey tunakutananga tu na moms wengine. We are there trying to, you know, advise each other. Na some people swear to give it even before the vaccine because you are afraid huyu mtoto asilie, like it will prevent. What would you say about that?
I would discourage the mummies from doing that. It can actually affect the antigenicity of the vaccine, and so it should be given at least 8 hours after the vaccine.
Okay.
Yeah.
Wow. Interesting.
So what the mummy should know is that it's an expected reaction for some. And the one that is quite antigenic when it comes to the vaccines that cause fever are the 6, 10, and 14-week vaccine. There is a component of that vaccine, the cellular pertussis, that makes it quite, you know, antigenic and therefore causes inflammation. It's quite dramatic. Fever, swelling on the injection site. Yeah.
And that is what will make the baby cry?
Yes, because of the pain.
All right.
Yeah.
And at what point, or rather, the reactions, can they be worse to a point that a mom needs maybe to go back to the hospital to get checked?
Yeah.
Or it's just, you just stay and they will just go away?
Yes, we've had children with, very few though, with adverse effects to vaccines.
Yeah.
Some are allergic to some of the components in the vaccine.
Okay.
So we use some proteins for you know, for purposes of making the vaccine more antigenic. We at times use some animal products, and at times there are children who could be allergic to this. You've also seen children who are given, though very rarely, during the campaigns, who also might have gotten oral polio, and they get some paralysis. Yeah. Yes. So you can get unexpected side effects from vaccines. Yes.
Okay.
As I said, especially from the live ones.
Okay. And from your profession, like when a mom comes, you are able to manage them?
Yeah, they are manageable. Of course, at times it takes time to go back, to trace back to what could be the cause of the symptoms you're seeing. But yes, it's manageable.
Okay. And what if a mom misses to attend to one of the vaccines? Ikupite tu labda ulisahau ama you know something just happened, maybe some get even into postpartum depression. Tuseme tu huyo mtu huyo amemiss hizo vaccines, you know what happens?
You just go with the book so that the healthcare worker is able to pick from where you stopped. And then they do what we call catch up. So say you missed a certain vaccine or you stopped at some point, they're able to pick up and create a schedule now specifically for that baby. Yeah.
And when moms are attending the clinics, is there a way like you tell, you know, the baby is doing okay and achieve milestones vizuri? What do you usually use? What do you usually like check during these checkups?
Yeah, we do something we call growth monitoring. So growth monitoring encompasses lots of things.
Yeah.
And we do weight checks. We do the height or the length. We also do the head circumference. We also check the milestones. Yeah. And milestones is not just motor milestones. Because you could have a baby who's, say, sitting or walking, but not talking. Yeah. So we do motor, we do fine motor, gross motor, fine motor. We also do social milestones.
Okay.
Yeah. We also want to check the intelligence of the child. Yeah. And yeah, so we check all that.
Okay.
Yeah.
Wow, thank
Then
you.
you're able to advise mommy.
Thank you. And as we wind up, maybe a word of advice, a word of encouragement to mom out there.
Okay, what I can say is that vaccines are important, and it doesn't matter whether your baby is getting baby-friendly vaccines or getting the KEPI scheduled vaccines. Take your baby for immunization, whichever you are able to afford. It's important. It's been subsidized by the government, almost free in some facilities, and we are able to control lots of immunizable and preventable diseases with vaccination. Yeah.
Wow. You can tell us when people can find you here at Emory Hospital. When do you have your clinics?
Okay.
Yeah.
We run the pediatric clinic on Wednesday afternoons, so you can drop in and you shall find me.
Okay.
Yes.
Thank you so much.
You're welcome.
Asante sana. Oh, that has been very, very informative, and I'm glad that you have learned something. As we keep the journey, we walk together because two are better than one. This has been the Real Life Cafe, and I've been your host, Juliet. Until next time, kwaheri.